That's week 8, turn 24. Not sure why I chose the absolute darkest area of my room to start recording in, but this is better lighting here. I also just recorded my entire video only to get to the end to realize I wasn't actually recording. So I'm just having one of those days. Looks like I got up to 490 centinewtons, up about 90 from 2 days ago, but still under my 700 centinewton threshold, and nothing's hurting when I expand. If I keep up at this rate, looks like I'm about 2 to 3 turns away from polycyclic turning, which should be interesting. Great question about the implants. I have an implant number 15, upper left molar, number 20, lower left premolar. When you expand the palatal suture, everything's going to move with the expansion, and then you need to move teeth back around orthodontically. The closer the implants are to the midline, to the center, the more challenging it is going to be to do expansion. For example, if you had implants on your upper front teeth, you may be able to do a tiny little bit of expansion, change out implant crowns, maybe veneer a couple teeth, but you wouldn't be able to get any significant amount of expansion without replacing the implants or just being okay with a giant gap in between your front teeth. Front 4 teeth, 6 teeth, that's going to be a challenging area. As you get further from the midline, they become easier to work with, but implants need to be taken into careful consideration during the planning phase of the case. It is quite possible that you will need to end up replacing an implant crown at the end of expansion in orthodontics, regardless of where it is in your mouth.